Are you chronically inflamed? Then one anti-inflammatory you may not be getting enough of is oxygen. Huh? I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Oxygen is very anti-inflammatory. We all know we need oxygen just to breathe and survive, but oxygen plays very important roles for us in the inflammatory balance of our bodies and also in immune function. So think about oxygenation. If you lack oxygen, it's very pro-inflammatory because essentially you're being choked from the inside out on a tissue level. So what leads to hypoxia or low oxygenation? Well, iron deficiency is a big one. Anemia, okay? Different blood disorders can lead to issues with oxygenation, leading to hypoxia, which is very pro-inflammatory. Well, guess what? The immune system uses oxygen to fight pathogens. So in order to fight an infection, our white blood cells use oxygen levels from the tissues to create free radicals like hydrogen peroxide and hydroxyl radicals in order to attack and kill the pathogens. So if we don't have enough oxygen, our immune response to pathogens suffers and we stay persistently and chronically infected, which is pro-inflammatory and feeds that vicious cycle. Another way that oxygenation supports immune function is natural killer cells. Natural killer cells are a part of the immune system that, again, deal with pathogens and also perform surveillance in cancer. And so if our natural killer cell counts are low, then we're at risk for chronic infection and or cancer. Well, oxygen plays a role in natural killer cell physiology because they mature along an oxygen gradient. So again, if we are hypoxic in our tissues or we lack oxygenation in our tissues, then our natural killer counts will likely be lower and less optimal or suboptimal, and therefore make us worse at fighting pathogens and at higher risk of chronic infections and the associated inflammation. And chronic inflammation leads to further tissue damage, potential for autoimmunity, et cetera, et cetera. So we need to oxygenate the tissues. How do we do that? Well, first of all, from a functional medicine perspective, we want to make sure there's no issues with iron levels, with circulation, with lungs, with any of the physiology associated with oxygenating the tissues, with mitochondria. Then we also want to look at lifestyle inputs that help oxygenate the tissues. So physical activity. If you're sedentary, you're not oxygenating tissue as well as you should or could, and so that's going to tilt you towards a pro-inflammatory state. Anything that drives hypoxia. If you are a smoker, you are creating a hypoxic environment, driving inflammation, and likely causing suboptimal immune function. So oxygenation can be driven by exercise. Oxygenation can be driven by exercise with oxygen therapy. Hyperbaric oxygen chamber therapy is another way to drive it. So using those methods can help drive oxygenation of the tissue. Avoiding smoking or getting rid of smoking, avoiding carbon monoxide, all of those things that could potentially be driving hypoxia in the tissues need to be avoided. So if you are someone who is a poor fighter of infection, you're someone who maybe feels you're always short of breath, or at your doctor when you have pulse oximetry done, you have low SpO2. If you have any sort of lung disorder that affects breathing, like asthma, bronchitis, COPD, those sorts of things, you may be tissue hypoxic, which is driving an inflammatory state and creating a suboptimal immune system specifically against infection. So breathe more and get as much oxygen in you as possible, move more, exercise more, and consider oxygen therapies with a practitioner that can provide those for you.